Good afternoon and welcome to the Akron Roundtable. I'm Karen Talbot, Board Chair and President of the Akron Roundtable Board of Directors. Today's program will be rebroadcast on WKSU 89.7 FM on December 17th at 8 p.m., sponsored by Layman's. This continues to be a different but effective venue for an Akron Roundtable event, and we're delighted that so many of you are able to join us for today at our virtual forum. We continue to sincerely thank the Akron Summit County Public Library for providing its talent and resources to make today's virtual event possible. Today, it's our privilege to welcome to the Roundtable stage Dr. Elizabeth Menifee and Dr. Jeffrey Moore. Their topic is mental health and COVID-19. You can read more about this month's speakers, future Roundtable speakers, and our Akron Roundtable podcasts by going to our website, akronroundtable.org. Akron Roundtable is grateful for the generous support it receives from sponsors, patrons, and subscribers. And you too can financially support our virtual forum series by going to our website to make a contribution. Our title sponsor throughout our 2020 season is Cleveland Clinic Akron General, and today's program is generously sponsored by the Summit County Alcohol, Drug Addiction, and Mental Health Services Board. We very much appreciate our sponsors and hope that you do as well. I'm fortunate to serve alongside an outstanding group of dedicated community leaders on the Akron Roundtable Board of Directors, a list of whom can be found on our website. Should you have any questions or suggestions regarding Akron Roundtable, please feel free to contact any member. During today's event, we'll be using Asker technology, which enables you to submit questions by way of mobile devices. Questions can be submitted at any time and will be forwarded for review during the Q&A portion of the program. Watch the screen for instructions should you need them. And after the formal broadcast, you'll have an opportunity to bring your voice to a conversation in one of our moderated discussion groups that we'll have available for a limited number of participants to test this new offering. Simply stay connected for that. The conversations will last about 20 minutes. Please visit the Akron Roundtable website for information about our January virtual forum when our guest will be David Giffords, Akron's own author, essayist, journalist, and professor. Today's speaker will be introduced by a fellow Akron Roundtable board member, Dr. Brian Harte, president of Cleveland Clinic Akron General. Dr. Harte will also serve as the moderator for today's presentation. Following that moderated discussion, Dr. Menefee and Dr. Moore have generously agreed to take questions from our virtual audience. Dr. Harte will also coordinate that portion of the program. Again, note the opportunity for you to participate in the moderated discussion groups at the conclusion of our formal program by remaining connected. And please remember that during our program, you can submit questions for the doctors at any time on your device through Asker technology. Dr. Harte?
Well, thank you so much, Karen, and thank you to all those listening here this afternoon, coming to you from the main library here in Akron. It's my pleasure to be here to both introduce our speakers and to moderate the panel for the next 45 minutes or so. So let me start out by actually introducing our speakers. To my immediate right here is Dr. Jeffrey Moore. Dr. Moore currently serves as the Vice President and Medical Director for Portage Path Behavioral Health, one of two large community mental health centers in Summit County. Portage Path is a safety net agency providing 24/7 emergency psychiatric services, residential treatment, intensive outpatient treatment, group and individual therapy, and medication management for psychiatric and substance use disorders. Dr. Moore previously served as chairman for the Department of Psychiatry and Behavioral Sciences at Cleveland Clinic Akron General, where he also served on the board of directors, and as a professor of psychiatry at Northeast Ohio Medical University. He is a diplomate of the American Board of Psychiatry and Neurology and a Distinguished Life Fellow of the American Psychiatric Association. Dr. Moore graduated from the University of Akron and the Ohio State University College of Medicine and completed his internship and residency at the Johns Hopkins Hospital Henry Phipps Psychiatric Clinic, and he's been active in teaching medical students and psychiatry residents since 1986. Farther off to my right is Dr. Elizabeth Menifee. Dr. Menefee earned her Bachelor's of Science in Microbiology from the Pennsylvania State University. She then went on to earn her medical degree from Northeastern Ohio Medical University in Rootstown, Ohio, just to our east, and completed her adult psychiatry residency here in Akron, Ohio, and her child and adolescent psychiatry fellowship at Cleveland Clinic. Dr. Menefee served as the director of inpatient services of the Cleveland Clinic's inpatient child and adolescent psychiatry unit after the completion of her fellowship, and assumed the position as medical director and more recently chief medical officer at Child Guidance and Family Solutions in Akron, Ohio. Her clinical interests include working with children, teens, and their families who are experiencing mental health challenges. She also enjoys working with individuals who are at high risk for psychosis or who have experienced their first episode of psychosis. She is board certified in adult psychiatry and child and adolescent psychiatry. And in addition to those clinical interests, Dr. Menefee is actively engaged in medical student, resident, and fellow education and has been since 2011. She is appointed as an assistant professor of psychiatry at NeoMed, working in clinical teaching roles and also teaching in the medical humanities curriculum. So, two of Akron's finest, and who better to speak today with what I hope will be both a lively and deeply informative discussion on mental health and COVID-19. So as we are here today recording this, we're a good 9 months into the COVID-19 pandemic here in the United States. As hopefully all of you know, Ohio is recording approximately 10,000 new cases a day, a number which has been increasing fairly dramatically. Our area hospitals are full, frankly, not just here, but throughout much of the United States. And COVID-19 is now, by a fair margin, the top cause of death on a daily basis in the United States, and will almost certainly end the year as the number 3 cause of death in the U.S., and I believe I heard this morning the number 6 in the world. Ohio, like other states, initially responded with a number of steps meant to mitigate the spread of the coronavirus, including closing businesses and schools. And since March, of course, we've been urging social or physical distancing, mask wearing, hand hygiene, etc. So regardless of the broader uptake, our world and our lives are decidedly different now than they were in the early spring, and they will likely continue to be so for some time. The direct and indirect impacts of both the pandemic and our efforts to slow it have been dramatic across many fronts, and we're here today with Drs. Moore and Menefee to have that dialogue about the mental health aspects of COVID-19 and the pandemic, as well as its broader impacts on individuals, families, and society. So thank you both for being here. So let me start off with just a couple questions. I'll start with you, Dr. Moore. Since we're in a virtual world, we're actually doing a virtual roundtable. Could you talk first about your professional lives and the ability to interact with your patients over the virtual platform that many medical practices have moved to? Could you talk about your professional experiences and the impact on your ability to take care of your patients?
Yes, thanks, Brian. Well, it hit us hard and fast in early March when the lockdown orders came, and we had done virtually no telehealth, that is, seeing patients over a video platform like we mostly do now. And I frankly didn't think much of the idea. I wanted to be with my patients, be able to do a little physical exam, see them walk, look at them in the waiting room. And so I was always kind of suspicious of telehealth. It was okay for rural settings. It was okay for orthopedic surgeons who could look at x-rays in remote emergency rooms and consult with the docs, but I didn't think it was any good for psychiatry. But it didn't matter because that's what we did. Within the space of a week, we went from no telehealth at Portage Path to all telehealth. Part of that was because the the regulatory bodies and the government suddenly relaxed all the regulations. Nobody liked telehealth financially because it reimbursed poorly and there were lots of regulations. All those were dropped, and we were encouraged to do the best we could, which we did. And most of our staff, clinical staff, were working from home. So your therapist or your psychiatrist was probably sitting in their den doing Zoom calls with the patients. And it went a lot better than I thought it would. It's actually been okay. We have some advantages in the sense that patients who would ordinarily have not shown up can now show up. So I've talked to people who were in their cars or were at home watching kids. I talked to a man with alcoholism who was drinking beer during our session. It's been a window into the homes and private lives of the patients that we never had before, and it's enabled people with no transportation to actually attend. On the other hand, it's been very difficult. Lots of glitches and technical problems. Many people, even if they have the tech, they don't really clearly understand how to work it. So we're constantly fiddling with the operating system and trying to make it go okay. So pluses and minuses. I think optimistically, we're never going back to no telehealth. After this pandemic is over, lots of our patients are going to want to stick with it. So that was the biggest thing that we went through, was an abrupt switch to telehealth visits.
Liz, it sounds like you do a lot of work as well with families. What has your experience been like?
Actually, our experience has overall been positive, and although I echo some of the sentiments that Dr. Moore has, as far as we've had to make this change very quickly, and it was not something we did a lot of. I had actually been doing telehealth for about 5 months prior to the start of COVID in some capacity. So we had played with the technology, we had explored it a little bit. I think one of the greatest advantages for the work that I do and our agency does is we're primarily a child-serving agency. And if you haven't realized this yet, kids and teens love their tech and are very comfortable with FaceTime and Zoom and how to use their technology. And so they adapted to it very quickly. I would say the biggest challenge that we've had as a child-serving agency is the really young kids that we work with, 3, 4, 5-year-old kids. It's hard to engage with them over technology in a meaningful and therapeutic way. We have gotten creative, and I have to say that putting our brains together to come up with the best way to engage kids and their families to make the time meaningful to them has been a challenge, but something I think we've overcome. I also think that, just like you said, Dr. Moore, this is here to stay. People really enjoy the benefits of telehealth, being able to not add in the drive time, pulling kids out of school. So I think it's here to stay in some way. We are just continuing to figure out how to make it work best for the clinicians as well as for patients and their families.
Great, thank you. Let's stick with kids and teens for a minute here, because one of the biggest impacts on families, at least, of COVID-19, the move to virtual, has been in the school setting. Most of our school systems have gone either partly or completely virtual at this point, really from everyone from grade school all the way up through college. So Liz, what do we know about, or what have we learned about the experience of virtual schooling and its impact in both the pros and cons column?
Right, and that's a great question. To say that COVID has had a big impact on how kids are going to school is an understatement. It has had a huge impact on kids, teachers, families, administrators, and the effects are really far-reaching. I think that just as we were saying, we've had to change how we provide healthcare, teachers in schools had to change quickly to figure out how to accommodate their students and all the needs that the students present with. And I will say I was really surprised. Some kids have done very well in the shift to learning from home. Those tended to be the kids who maybe had some social anxiety or struggles when they were in large groups. For them, it was a relief to be at home. However, a lot of the kids that I work with have special needs and academically struggle without the structure. So kids who may be on the autism spectrum or who have ADHD, the structure that school put in place and the special skill set that teachers have to teach and educate these children wasn't available to them anymore. So some kids did really well and some kids struggled. I think that the spring was an opportunity for learning, and families really quickly had to find space for their kids to learn. And there were certainly some discrepancies if families didn't have enough computers, didn't have space for each of their children to learn, didn't have Wi-Fi at home. And so that was the spring, and I think over the summer, some schools did really well and rose to the challenge to create the best learning opportunities given the unknown circumstances. And I think some schools struggled. There are discrepancies, as we're aware, between different schools and school districts. I would say one of the large challenges is how do we teach our children if they're not in school and parents are working? And that is a whole different layer. Most of us who are parents are not teachers, and I think we've gained a great respect for those teachers and educators and the work that they're doing. So we have seen a lot of challenges, whether it's students staying focused, having what they need to be successful in school, parents providing the teaching and supervision, and again, I think some schools are doing very well, some schools are struggling, some kids are doing very well, some kids are struggling, and it's an ongoing process to figure out, again, what we can continue to do better and how we as parents, as community members, and as professionals can do to support those kids and families.
Great, thank you. Could you talk a little bit, Jeff, about what you're hearing and seeing about how parents themselves are coping with all the things that Liz described, the challenges of their own jobs, the need to try to supervise their own kids' learnings, and of course keep themselves and their family as safe and healthy as possible?
Well, it's no news. It's been tough on everybody. So not just parents, but surveys across the country of the general population show 3- and 4-fold increases in significant anxiety and depression. We've got a significant bump in suicidal ideation, sometimes serious, and substance use disorders. So people are abusing drugs and especially alcohol. Alcohol sales are up like 25%, and you know that's going somewhere. So there's concern, too, about bereavement. We've got millions of family members who've lost somebody to COVID, and all of the usual bereavement rituals that help to prevent what we call complicated grief are missing. So there's no visitation in the hospital, there's no funeral rites in whatever culturally adaptive way you would have done it otherwise. It's been very difficult on the bereaved, and in addition there are people with post-traumatic stress disorders, acute stress disorders. People who have survived a long stay in a hospital ICU have a much higher incidence of PTSD after that experience. And I think we're just sort of bracing for a wave of trouble after things get a little bit better. It's been very hard on everybody.
Liz, how has this uptick in both uncertainty and mental health disorders impacted the family unit?
Well, we know that when you have an increase in parental stress and an increase, you often see an associated increase in the stress of the child. Parents are modeling behaviors, and if they're not able to manage their own stress, it may come out as anger towards the children. It may come out as more irritability or substance use problems that we're seeing. So it is not often isolated just to the parent or just to the child. It is often in tandem.
So we've touched a couple times now on some settings of virtual either healthcare or schooling or other settings, and yet the ability to succeed in that environment seems like it's very dependent upon access to technology. So that really raises the issue of socioeconomic disparities. We know from a medical standpoint, COVID-19 is, like many other illnesses, has a more severe impact on individuals who suffer with socioeconomic disparities. Can you talk both about either the medical care side, and maybe start with you, Jeff, the medical care side, as well as the learning side, about the impact that socioeconomic disparities are having on the ability to either provide effective care, receive effective care, and or schooling? And maybe you start, Jeff, and then go to Liz.
Well, I guess it's had the worst impact in our patient population at Portage Path on the severely and persistently mentally ill folks. These are people who have maybe poor insight into the fact that they have mental illness and need a lot more structure around their care than other folks do. And that structure was provided by physically showing up to our clinic and interacting with our staff. It's been hard on them because we can't keep them engaged in services. We discovered something as simple as when we were done seeing such a patient, we would walk them out and hand them off to the receptionist, who would make sure that they were rescheduled and had everything that they needed done. Now we end the Zoom call, and we hope that the secretary will be able to find that guy again in an hour to reschedule an appointment, but it often doesn't happen. Those patients are also poor and don't have access to tech, or have cognitive impairments that prevent their being able to adequately use it. They often have conditions that require them to physically show up to the building for a urine drug screen or a physical examination about side effects of the medications they're on, or a long-acting injection, and they're missing those more and more. So we have a lot of trouble maintaining engagement with these folks. It's just been tougher on that population of especially poor and chronically psychotic patients.
Liz, what do we see from the school setting about these disparities in
Right,
access?
and I think there are disparities from an academic standpoint, and then there are the disparities in the things that are related to school but not necessarily academic. So first off, there are some families who perhaps had the financial means when things were up in the air with their home school district to say, we want to make a different decision and either hire a tutor to come in or send their child to a smaller school that had perhaps a different plan on how they were managing COVID protocols. So there are certainly some families that had the ability to make those changes, and there are certainly families who, because of where they live or financial limitations, were not able to make that and have to figure out how are they going to get the computers, how are they going to pay the Wi-Fi bill, especially if places like libraries where they maybe went before were closed. The other piece that's really important and oftentimes related to schools is a lot of children relied on school districts for free meals. And they don't have that on a daily basis now, where they're going and getting breakfast and lunch for free at schools. The schools have done a great job of trying to provide those in other ways to families. They can go and pick them up, but it certainly is not the same. And we know that that there has been a significant increase in food insecurity recently, and so I think it's important to remember that aspect of the challenges right now. And we know if kids are getting low cost but low nutrient dense foods, that has even longer term consequences if you're eating McDonald's every single day, as opposed to what the schools may have been offering in other times.
Great. Just as a reminder to folks, you can ask questions through the Asker technology through the link that you would have received. The questions are starting to come in. We'll get to them in a few minutes here, so please send them on in. Now, Liz, I am a parent of 3 children, and I spend much of my waking hours trying to restrict their screen time. And now, since I guess April or so, we've moved into a setting where they're on their screens for school for what seems like untold hours through the course of the day. What's going to be the impact? What is and what will be the impact of all this screen time on developing brains?
I love this topic. I love talking about technology and kids because this is something we could have talked about for a long time before COVID. Before COVID hit, kids 8 to 12 were spending 4 to 6 hours a day on their devices, and teenagers were spending on average 9 hours a day on technology. And those numbers continue to go up. Part is because now they have to be on Zoom or their computer for school, but kids just have more time to be on their devices. And I found this fact recently that about half of kids under the age of 8 have their own tablet, which, it was just mind-boggling to me. What some of the preliminary results have shown is that screen time has increased since COVID and physical activity has decreased since COVID started. And there are a lot of consequences to the increase in screen time. Number one is that it can lead to disrupted sleep for a number of reasons. We all know that there's different light that comes from our tech devices that can stimulate the brain to stay awake. And if you've got your phone next to you and an alert's going off, you want to check your notifications and it's right there, you're not going to get as much sleep. And I think we're all guilty of it. My guess is if you're not watching this presentation on your phone, it is somewhere within arm's reach of you. So we are all guilty of it. The other things to consider is that if kids are engaging only in online activity, they're not building up the social skills that they would be otherwise. And especially for young children who are in the age of language development, if they hear language, it's one thing, but when they're engaging with an adult and learning that back and forth conversation, that's when language development is growing. And so it's so important. I often share with families that they should go to the American Academy of Pediatrics Family Media page, and you can just Google AAP Family Media page or Family Media Plan. And it gives essentially a blank template to have a discussion within your family about how you as a family want to use technology. You don't have to think of everything on your own, but it gives some guidance about when it's appropriate to use it, where the phone should be charging. Hint, phones should not be in your kids' bedrooms overnight. They should be out of their rooms. That's no one's favorite, but it's one of Dr. Menefee's rules. So I think that it's really important, and I'm sure, we'll talk about schedules and the importance of that, but really monitoring what your kids are watching, also as a parent modeling behavior. So if you're telling your kids not to have their phone at the dinner table, you shouldn't either. So it's a great question. I love talking about tech, and it's just spiked since COVID.
Great, thank you. One more follow-up for you, Liz. You talked about the developmental aspects of the social component of school, but there's also, at least what I've observed from my kids, is that they're spending a lot of time, even when they're in school, isolated, physically isolated and socially isolated. So what do we know about the impact that this prolonged isolation is having on the instance and course of underlying mental health disorders in kids?
There was, I believe, a psychiatrist, and I'm going to have to look at my notes for his name, otherwise I'm going to butcher it, Harold Koplowitz, I believe, and he came out with some categories. Yes, Harold Koplowitz came out with some categories that I think are particularly relevant when we're in the midst of COVID. And the first category would be the mentally healthy. So people who, they have stress in their life and they manage it, but don't necessarily have long-term consequences from that. The second would be a subclinical level, and they might have some stresses, they may have more worry or symptoms, But then when there's a stressor, an external stressor like COVID, it could take that from a subclinical or non-diagnosed mental illness to something and raise that up to a diagnosable illness. And then again, if someone already had a diagnosable mental illness, these external stressors can bring it to a more severe state. So we know that COVID, we know that isolation, not having your normal supports, is a significant stressor and can really push people who we're managing into a state of distress, or people who are already struggling with mental illness to a point of needing higher level of services.
Jeff, you want to talk about the impact perhaps on the adult in various settings of being isolated for so long?
I think, yes. I think the worst of it is elderly folks who are living in nursing homes and assisted living facilities. So I'm sure you know that 35 or 40% of the deaths are in nursing homes and assisted living facilities. It just runs rampant once it gets into the population. So the facilities have responded by just locking everything down. So those patients are previously they attended bingo games and activities and were able to come and go as they pleased. Now they're literally locked in their rooms, not locked, but they're confined to their rooms with essentially no programming. So even those who don't contract COVID are suddenly cut off from visitation by friends and family and from social activities. And that's bad for these patients. Their cognition is at risk and begins to decline from kind of atrophy. They don't know what to do with themselves but sit around and worry or watch the television. And the staff, especially if there's a COVID outbreak in the facility, the staff are super stretched thin and anxious and will kind of neglect the patients that don't have COVID just because there's not enough of them. And some estimates are that we'll see probably 150,000 additional deaths in these facilities just because of isolation, neglect, failure to follow through on the early warning signs of an exacerbation of non-COVID illness. So it's been and is continuing to be very difficult for that population.
Thank you. I want to pivot just for a second. Can you talk a bit more about COVID-19 as a disease? So we commonly think of it as a disease that causes in most people respiratory symptoms and fevers, but we also know that in many cases it has widespread impact throughout the body. Could you talk about what we know about the neuropsychiatric effects of coronavirus infection?
Sure. Well, everybody has heard that it impairs your sense of taste and smell. And that's probably a direct effect on the sensory apparatus for smelling rather than a brain effect. But the patients who are sick, and I'm sure you know this pretty well, these patients are real sick, and they're in the ICU, and they have difficulty breathing. So they're on ventilators, but maybe not fast enough, and they get brain injuries. They have, the first wave in New York, a study was published that said 13.5% of their patients had some new neurological complication. They had delirium, a confusional state caused by general medical problems. They had seizures, strokes, some of them lots of small strokes or a big stroke. And then afterwards, these patients take a long time to recover. You've heard about COVID fog and the long haulers. We think these patients are suffering from chronic headaches and dizziness and stuff because they've had minor brain injuries. If the patients were anoxic bad enough for long enough, they get anoxic injuries to the brain, and those can be subtle. So it's not like you had a stroke, but you're not quite the same after a very, very serious ICU illness. There was another study in Spain after their first wave that found a high incidence of neuropsychological sequelae. So these patients have difficulty with executive functions, planning, ordering, arranging things, and are, have clearly abnormal neuropsychological tests. So we're concerned that we'll have this group of long haulers and we'll have to be figuring out what to do to help them to fully recover.
Great, thank you. Liz, a few minutes ago when talking about older adults, particularly those in congregate living facilities, he used the word neglect. And that raised a red flag in my mind and reminded me that the three of us as physicians, and of course school teachers and many others, are actually mandated reporters of abuse. Can you talk about what we're learning about the incidence and severity of neglect, abuse of kids? In fact, this would be a question for both of you. Intimate partner violence. What have we seen over the past 9 months, and what are we fearful of going forward?
Sure, that's a good and a very important question. We historically have relied on where children are as the eyes on children to make sure that they are safe. So primarily teachers and pediatricians and other doctors that come in contact with kids and have eyes on them to look for subtle changes or look for bruises or find the kid who doesn't have a place to sleep. And we are all mandated reporters, which means that if we have concerns about abuse or neglect, we are mandated to make a report to the appropriate agencies to do a further investigation. So there's certainly concern that if kids are not in school and all the teachers see is a Zoom box head, that they might be missing other signs of abuse or neglect. We do know that for some children, home is not a safe option for them. And we knew that before COVID, children, that child abuse was not uncommon. In fact, the CDC reported that 1 in 7 children had experienced abuse or neglect in the year prior. And we know that when there's an increase in parental stress, whether that's financial stress, whether that's illness, whether that's COVID, whether that's trying to keep food on the table, if there's an increase in parental stress, not only do you see an increase in substance use, but you also see an increase in child abuse. We know that stressed parents may not have the skill set that's needed to respond to their children who are also in a stressed state. In addition to that, certain shelters are closing or may be underfunded, and so they're not able to provide what they had previously. So it certainly is something that we as clinicians are continuing to figure out: how can we best monitor these situations? How can we make sure that we're not allowing these children to slip through the cracks?
Jeff, anything to add?
Well, on the subject of intimate partner violence or domestic violence, which is mostly men beating women that they live with, we're concerned that there's been an increase in that. The reason for that is case reports and some data that has been collected, but also just step back and look at the risk factors for that sort of thing. We have massive unemployment, a large increase in drug and alcohol abuse, social isolation, so that the victims literally can't get away. They're locked up in the house. There's no place they can go anymore to escape. They can't, get out and get to their sister's house. And male unemployment. So the man is at home, and the woman has no place to go, and it's a bad scene in terms of risk factors. Some of the early reports show an increase in the total numbers, but we're very much afraid that we're not getting those numbers accurately, that the reporting is poor. There's an increase in the severity of the injuries that are being seen, and that probably means that the total number of assaults and injuries is much higher, but the hospitals are seeing the severe injuries. So it's a concern, and I think that we'll find out what's happened as we come out from being locked down.
So I have to confess that I've painted a fairly bleak and dire picture of the current state of public health as regards to COVID-19. I'm going to start taking some questions. And many of the questions have to do with how do we respond? How do we take control? How do we take charge of something so we can feel that we're not completely victims to this? And I'm reminded as well that at the hospital now and throughout, frankly, the world, we're talking about approval and distribution of vaccines. So we do see hope on the horizon from the standpoint of perhaps the beginning of the end. But in the meantime, we're going to be living with this for a while. So I'm going to take a couple questions which really ask about what we can do. So I'll actually start with you, Liz. Do you have advice for young teens who are struggling socially, how to make and maintain friendships when this, as you mentioned before, is really a developmental time for learning about friendship and connecting with others? What can we as parents, how can we help our kids with their social skills, especially those who struggle?
Right, and that's a great question. I think that this is a really great opportunity for the use of technology. Schools who may have had clubs in person, you can reach out to the schools to see if the clubs have transitioned to online. So figuring out what your teenager is interested in, looking to the school or looking online to see if there are any organizations that are related to that. The public libraries often have some groups or activities that you can turn to, and really helping to support your child to check in and say, have you reached out to so-and-so, your friend, or checking to make sure that when they're going up to their room that they're not isolated and bringing themselves down. Are they going up to reach out to a friend that they hadn't? I think that regular, at least once a day, every other day, encouraging your child to make an active effort to stay connected with someone, whether that's a friend, whether that's a family member. Sometimes it takes a little nudging, but it is so important.
And picking up on that theme, Jeff, what are some things that adults and frankly even organizations for whom the care of adults may be charged can and maybe even should be doing to combat that loneliness that comes with isolating?
Well, again, unfortunately, I think it has to be tech in many cases. So in the nursing homes and assisted living facilities, they bought a bunch of iPads. And the people who formerly did the programming are now setting up visits via iPads because a lot of times the old folks can't figure out how to work it. A lot of times the young folks can't figure out how to work it. So they're setting up virtual visits with family members. I think that's very helpful. For people who are physically able, I think getting outdoors, do stuff outside. You don't have to worry near as much about getting and spreading infections, and you need the physical activity, and it's good for you. And membership in what organizations are remaining, faith-based organizations, that sort of thing, take the extra time and effort to try to maintain social connections.
Right. Again, a lot of questions about sort of asking for advice on how to manage or cope. So there's a couple here that speak to students, and so I'll try to amalgamate them in a question for you, Liz. For students who struggle with executive functioning, and in another example, children with social anxiety or even autism. Let me bucketize these separately. So let me start by saying, for students that struggle with executive functioning, what are some things that can be done to help them focus or give structure to their daily tasks? Let me start with that one.
I think structure, regardless of whether it's related to school or just trying to get through the day, is really important. I'm a big fan of encouraging children to chunk their material, so break it down, and making lists. But when your child has to be in front of a screen for their entire day, making sure that you can provide them with some breaks, and that might mean reaching out to the school to figure out, talking with the teacher, how can we chunk this material, give them a certain amount of time on the computer, and then they can go and run around the house 3 times before they have to come back. So it's hard if your child already had some of those challenges and you don't have all of the classroom supports and structures in place. Creating a space for them to only have for the learning. So do they have a corner of the table? Do they have a desk where they can do the work, so that they begin to associate that with only schoolwork? Organizing their day, setting a clear schedule for them, and giving them some brain breaks would be things that I would recommend.
And then a second question. In fact, you mentioned before about kids with special needs and even kids on IEPs. What about kids that have social anxiety or autism who might actually be doing better from a learning standpoint with virtual technology, but who really have special needs around social skills and maybe falling backwards? Do you have thoughts or advice for them?
Another good question, and I would say there's a couple of different layers to that. If your child has special needs, especially related to social skills deficits, if they're in treatment, you can ask your treatment provider, are there any groups, even if it's virtual right now? So we have shifted at our agency any in-person groups to online, and we are figuring out, as with everything, we're figuring out what works and building on that. And then the other piece is if your child is doing well at home and not in that face-to-face environment, I've been telling people, let's use this time to start practicing some of the skills so when you are back at school, you feel more comfortable. So it's almost like dipping one toe in the water and practicing your therapeutic skills, and then dipping 2 toes in the water so it's not as overwhelming. Because the goal, of course, is to get kids back to school, and we want everyone to be successful when they do go back. So encouraging people to practice the skills in a therapeutic environment so that they feel more comfortable when that time comes.
Great. A question that many of us that live at home with families might be able to sympathize with. I'll ask you, Jeff, and then you, Liz. Advice, guidance, or direction as in terms of supports that might exist for parents who feel at their wits' end, and I'll read this literally, now that they are dealing with the whole family at home at all times, working, studying, cleaning, cooking, relaxing, and maybe perhaps just generally getting on each other's nerves all the time, and the impact that might have on the family dynamic.
Yeah, there's no real good answer to this. Liz talked about a schedule. I think, so when I babysit the grandkids, my daughter leaves a typewritten schedule with what's going to happen at 9 o'clock and what's going to happen at 10 o'clock. And to my astonishment, the kids put up with that and actually seem to thrive in that. There's a lot less fighting and screen time. So I think that's what we need to do for the grown-ups as well. You need to sort of plan ahead your day and plan in some alone time, plan in some outdoor time, some physical activity time. But it has to be intentional. Otherwise, you find yourself 4 hours into, binge watching some garbage on the television.
Or on TikTok.
Or on TikTok if you're a young person. So yeah, I just think you have to be very planful and intentional about how you structure your days when you're all locked up together. And give the kids their own space. Check on them from time to time. My granddaughter texts me while she's supposed to be in virtual school. I get very suspicious about that.
I think it's interesting. You and I have very similar ideas. I think the things that work the best in these times are things that probably our grandmothers talked about, which is get outside and move your body, eat something decent, and drink water, have a schedule, sleep. I mean, these are all really, really important things, and if you are in one place all the time and you don't make a conscious effort to put those into your schedule and develop a routine, it's going to slide by the wayside. But those things are going to be so important for kids, for teenagers, for adults, for grandparents, and it does get you that alone time, gets you that vitamin D, gets you those endorphins, which are really important.
Great, thank you. And this will be my last question before I turn the podium back over to Karen. Someday, hopefully a few months from now, the pandemic will end and we will write the final chapter and the epilogue on this really sad and what's been a terrifying story. What will that epilogue say? I'll ask this to each of you, starting with you, Liz. What will that epilogue say about how we handled this, what the long-term sequelae would be, and or what we learned about ourselves as a society and our ability to manage through mental health concerns through COVID-19?
I hope, number one, that we can look back on it and say that we handled it the best that we could given the resources that we had and the knowledge that we had, and that it showed our ability to be flexible and meet the ever-changing needs. I think we are going to look back and see that people value telemedicine and telehealth, and I hope those changes are here to stay. I think that we're going to look and see that there were health disparities and educational disparities, and that we need to work to bridge the gaps between those who have and have not in both medical settings and educational settings. And I think that hopefully this will continue to show the value and importance of being kind to yourself and compassionate in these stressful times, and the importance of taking care of yourself and your mental health just as much as your physical health. I feel very strongly that my colleagues in the mental health field are working hard to take care of themselves, take care of their patients and their families, and I hope that we can look back and say that we've done the very best that we could.
Pretty similar. I think we'll look back on this and say, well, we muddled through and we did pretty well. Could we have done better? Sure, but it's always easy to say that in hindsight. I think we're going to be dealing for years to come with the PTSD, substance use disorders, the patients who are long haulers, whatever is happening in their brains. I think we'll be dealing with that and get better at doing that as time goes on. I also think some of the things, so everything's been thrown into complete chaos and sort of thrown up in the air, but that's an opportunity. Previously intractable problems have been blown up, and so we can fix problems that we couldn't fix before. We can see things in a new light as the chaos settles down. So we have an opportunity to restructure some things. The telehealth is a good example. We should have done that years ago. It's good for a bunch of the patients. Who knew? Now we do. So I think there will be some things that will come out of this that will be actually beneficial.
Dr. Moore and Dr. Menefee, thank you so much for being with us today. And on behalf of the Akron Roundtable, it's my pleasure to present to each of you a contemplative sun as a memento of your time with us today. The celebratory work of art was designed exclusively for Akron Roundtable by local artist Don Drum. And to our audience, thank you all for joining us, and we look forward to seeing you again at our January virtual forum. And a last call that if you wish to participate in one of our discussion groups, please stay connected. From all of us at Akron Roundtable, we wish you a safe, healthy holiday season and every best wish for 2021. Have an enjoyable day.